Hello, everyone, and welcome to PhysioEd's Active for a Lifetime webcast. I'm Dr. Kaitlin Ryan, and today we are going to be talking about some assistive devices that you can be using if you're having some issues with your walking, whether that's strength or pain or some impairments in your balance. As always, these videos are intended for general education and movement strategies and are not provided for individual diagnosis or treatment plans. So if you have any specific concerns, please consult them with your healthcare provider. So we are going to get started going from kind of the least supportive to the most supportive for our assistive devices. The most supportive assistive devices are typically the walkers, and the least supportive are kind of the single point, either a cane or even sometimes the walking stick. So for the most part, you are going to have a walker if you have more imbalances or more pain and you need more support. The canes or the walking poles, those give a little bit less support. So those are for people who are just looking for a little bit of additional. Maybe you have just a little bit of balance, or you just feel like you need a little bit of help with your energy conservation on like longer walks or hikes, that sort of thing. So the walking poles, they come in all different sorts of materials. Sometimes there's aluminum and carbon fiber as the most common. The aluminum tends not to break or shatter quite as easily as the carbon fiber, but the carbon fiber is less weight. So that would be really helpful if you are looking for energy conservation. You don't want anything that is going to slow you down. The walking poles are excellent if you have just a little bit of instability with the balance and you're just looking for just a little bit of extra support. Sometimes they're very helpful if you have an arthritis. They're mainly meant for kind of the longer distances or the more strenuous hikes that you would be going on. Typically, you can have different hand grips as well. They are foam, they can be rubber, or they can be cork. A lot of times the cork is a little bit more breathable. Some people really like the foam just because it gives a little extra cush and can be breathable as well. The rubber, if you're anything like me, I get super sweaty hands, and so sometimes they're a little bit harder to grip onto. When you are looking at your walking poles, they come in different adjustments as well. They've got ones that twist, some that are the levers, and other ones that are kind of the push pins. We really like the levers because you can be very specific with your adjustments. With the twisting ones, sometimes if you're overusing them, they can just kind of wear down over time a little bit faster than if you were to be using the lever or if you were to be using the push pins. The push pins, you can't be quite as specific with your height adjustment. So for the height adjustment, you really want a walking pole that when you are holding it at the hand grips, that your elbow is bent at 90 degrees and your forearm is parallel with the ground. And you can make small adjustments depending on whether you're going uphill or downhill, but in general, that's kind of the height that you want to be going for. So in addition to those, there are also canes. So canes can come in a couple different forms as well. A lot of times the single point cane is kind of the most common cane that you think about. This is helpful for if you just had a surgery, only one side has some back or has some pain to it. So maybe your left knee is the hurt knee, and that's the one you have difficulty with. The cane is usually more for use throughout the day, throughout your daily activities, not just for those strenuous exercises. Or if you've just had a surgery, the canes are really nice. So the canes themselves, they come in a couple of different forms. So the single point cane is the one that is on my screen right now. You can see on the bottom that it just has that one point of that cane. So that is really nice if you have just need a little bit of extra balance support, a little bit of pressure relief for maybe a surgical leg or a painful leg that you maybe need surgery, but you're not quite there yet. So these are intended for use throughout your day, not just for the long hikes and the long walking. You can see some single point canes that have a base that are wider at the bottom. Those are more intended to be able to stand upright by themselves without having to lean on anything. But a lot of my patients don't really like that because for the walking, it just makes it a little bit clumsier than a single point cane. It's a little bit wider of a base. The other options for canes would be a small based quad cane or a large based quad cane. And you can tell that there's the quad because there's 4 points on the ground. So with those 4 points, they give you extra support and extra stability. So maybe you need more pain relief or more weight unloading. with the quad cane than a single point cane can give you. So those quad canes are actually really nice for extra support if you feel unsteady going upstairs, maybe just a couple of steps. Maybe you don't have any hand railings on either your apartment building or your home. And sometimes those quad canes are really nice because they add a little extra support where you can really put a little bit of extra weight down. They do also make large based quad canes. Most patients find those a little bit more clumsy, but if you're not really sure which cane to be going for, that might be something that you want to speak with your provider about specifically. So, those are primarily the canes and the walking poles. There are also walkers. Walkers are having the 4 points. What I like to do is have people test out different devices. So, and when they are testing these out, all I want them to think about is what do I feel safest with, or what do I feel most stable with? Forget about the aesthetics or the looks of whatever this device is. You just want to use the device that is most comfortable for you and makes you feel most supported in the way that you need to be. And with walkers, they provide a little bit of extra support, either if you need some heavy weight bearing, if you really need to unload some of your joints, or if you have some bigger balance impairments, whether that's from a neuropathy or if it is from a neurological condition, whatever it may be. Those walkers add a lot more support than just a cane can add, or even those walking poles can add to you. So there's a few different kinds of walkers. I'm going to go over 3 different kinds today, but there are more than just what we'll be going over. These are just the primary ones that will be used, or I use as a home health physical therapist. This one is called a front wheeled walker. What is nice about these walkers is that the front wheels, they can be used more for sliding and less for kind of a standard walker that doesn't have any wheels where you can kind of pick up as you go. These are most common for significant balance impairments where you really need to put a lot of pressure or post-surgery. So these can be great for really unloading some joints that are painful as well. These provide really good support and are meant for really pushing down. Now, you want to get the proper size. They have different weights and heights. Really, what you want to do is kind of measure up from the ground and then measure up to the wrist crease. That's going to tell you where your hand grip should be and kind of what height walker you can go for. Almost all of them are adjustable, and you just want to be specific and be careful about the width that you get. Some people live in older houses and the door jambs will not fit a walker. So you kind of have to play around with that. Sometimes you need to get a bariatric walker that just can hold more support depending on how much you weigh or what your size is. So those are the front-wheeled walkers, offering more support than either canes or walking sticks and helping with unloading. But sometimes they're a little bit tougher, especially when you're outside. So a lot of people who need some extra support when they're outside that the cane or the walking stick can't provide, you'll get those rollator walkers or those 4-wheeled walkers with the seats and the brakes. So here is that rollator walker. You can see the 4 wheels on the bottom and they're much bigger. So they're easier for going over uneven surfaces, gravel, or a sidewalk that's uneven. And they can be used also as a chair. Make sure you lock your brakes though when you are going to be using that as a seat. I like to tell patients who are having a lot of difficulty either with some COPD concerns or maybe even some cardiac issues, they just get tired a lot faster. So this walker can be used as a way to conserve our energy just because we can provide more support through our upper extremities as well as our lower extremities so people can walk a little bit further distances. But this is also just a chair. Wherever you are, you have somewhere that you can sit, even if it's at a grocery store or you're going somewhere people are constantly looking for benches if they can't tolerate those community distances very well. So these can be excellent for people who aren't able and need to take a rest. And you don't always have a seat whenever you can rest. Now with these, they are really difficult if you know someone who has a memory impairment. It's hard to remember to be locking those brakes or using the brakes properly because anytime you're going on and off a surface, especially on and off the walker, those brakes have got to be locked. So these I tend to be a little bit more cautious with if I am working with someone who has a condition like dementia, just because sometimes they can be more of a hindrance if they're not used properly. These walkers have 4 wheels and they can roll on you a lot faster than just those front-wheeled walkers. So these are meant for people who really have pretty good balance and they're not pushing down heavy. These aren't really meant for people with lots of pain or with significant balance impairments. It's really for people who need a lot of energy conservation and a little bit of stability help. Again, with these walkers, it is all about the safest use for you and what you feel more stable with. In addition to that rollator walker with the seat on them, they do also have other walkers that are called upright walkers. So what's excellent about these upright walkers is that they provide a forearm support. Let's say you don't have very good hand strength, or you have a lot of arthritis in your hands or rheumatoid arthritis, and you can't use your hands as well as you would like to. So you can't necessarily grip onto a front-wheeled walker or a rolling walker quite as well as you should, or even walking poles. What's nice about these upright walkers is that they have those forearm support, so you can really put your weight on your forearms to help you with that stability if you don't have quite the hand strength to be able to hold on to some of these walkers. A lot of people will also use these if they have a lot of back problems, just because that forearm support really helps with a lot of taking over a lot of the strength that your back muscles need to have with supporting yourself and staying upright. And you can lean on these walkers with your forearms. It takes just a load off your back is really the big thing. And again, the four-wheel walkers, great for outdoors, uneven surfaces like gravel or asphalts compared to the front-wheel walkers. And then they have the seat as well if you can need to take a seat. So the upright walker, it's fantastic to be using if you need some support for your back and you can't use your hands to help you on some of these other walkers. The forearm supports really kind of help take that load off your back. And with all of these assistive devices, just as a recap, the walking poles are excellent for intermittent use over some longer distances or like hiking, that you only need it for those times, not all the time. And they're great to help out with a little bit of balance and a little bit of pain relief and a little bit of extra energy conservation. In addition to those, you've also got the cane. Same thing for a little bit of extra support and a little bit of pain relief, but they're really meant for all day use, whether that's arthritis or if you're going to be having a surgery. And you've got the single point cane or that quad cane. You've got the small base quad cane and the large base. We went over the small base today, and that small base can just be a little bit helpful because it gives you a little bit more support so you can put some more weight down than that single point cane can. After you're done with your canes or your walking sticks, you've got your walkers next. So that front wheeled walker, that can be offering some more support, certainly more than the canes can. They're used for kind of unloading your joints or pushing down on the walker. So then your legs aren't getting as much use, whether that's for a surgery or a lot of pain, or if there's just extra, even more balance impairments. So those are really good to be using indoors. Outdoors, a lot of times you want to use a rollator walker, the four wheels and the seat. You always have a chair to sit down, and those big wheels are easier for going over the uneven grass or asphalt, uneven sidewalks, the gravel, those kinds of surfaces. Just remember that they are going to roll away from you a lot faster than a front-wheeled walker or a standard walker would. And they're not always great for people who have those cognitive impairments where they just don't have as good a memory to remember to press the brakes or lock the brakes anytime they go up and down. And that upright walker, those are good if you don't have as much support for your hands, either more pain or not as much strength to hold the walker or the canes, and you need that extra support from your forearms to help you unload either your back or to conserve your energy or your balance. Thank you guys all very much for joining me today with PhysioEd's Active for a Lifetime webcast. I hope you guys found this helpful, and I hope you are going to check us out also at physioed.com. You can also check us at the private Facebook group, Healthy Aging and Movement Over 50. physioed.com. You can find out some articles and as well as more information about other services or ways to contact us directly. If you have some more fine-tuning questions, please again seek out a provider. Physical therapists can be very helpful in providing the right walker recommendation for you, and they can be very specific with their assessments and evaluations. Look forward to working with you guys in the future and happy to help you stay active for a lifetime. Thank you very much.